As of this morning, March 13th, CDC is reporting more than 1,500 cases of COVID-19.
If we only knew then what we know now, back those nearly 500 days ago when coronavirus was declared a national emergency in the U.S. Reflecting on this pandemic years from now, doctors think we'll be impressed by the speed of science, but depressed by society's response.
The most important, I think, is that thwarting a virus in a pandemic is a combination of a medical and scientific endeavor and a socio-political endeavor.
Early on, sequencing the COVID-19 virus helped scientists develop tests, vaccines, treatments, and even track the virus variants today. One hindsight lesson, getting tests to people quickly. The FDA didn't greenlight rapid or saliva tests until late spring, summer 2020.
Spring of 2020, really no one could get tested. It was almost impossible to get testing. Now you can go to your local drugstore and get a home test kit to really help us understand and control this.
And of course, there's vaccines. mRNA research helped jumpstart Moderna and Pfizer's vaccines, now in the arms of more than 163 million Americans.
The vaccine has been very, very effective, and we're seeing it to be very effective and very safe in a lot of people, hundreds of millions of people who have received this vaccine.
But of course, there's the behavior part. Both vaccines and masking have been slowed by hesitation and politicization. The latest Kaiser Family Foundation data show more people in Republican-leaning and rural areas say they would definitely not get a COVID vaccine.
I haven't gotten it. Probably won't get it.
It's a new vaccine, so I'd rather wait to see what happens in the future with that.
I'm personally done with the masks for my child. In my opinion, it's a choice we've made for our child, and he is immunocompromised.
It's going to has already led to hundreds of thousands of deaths more than we needed, and I think we're unfortunately staring down at another few 100,000 deaths that did not need to happen.
So, have we learned? We have more tools, to be sure, and the data to back it up. But currently, unvaxxed and unmasked situations mixed with the highly contagious Delta variant, now making up about 80% of sequenced COVID cases, it's a perfect storm, leaving hospitals and those working in them feeling deja vu.
It just seems like we're just fighting a losing battle here.
We have the capacity now to really shape how we can behave, but it will require some behavioral modification for us to have that normalcy. It comes at a cost. It comes at wearing masks. It comes at vaccination. It comes at washing our hands as much as we can, and potentially testing and screening. Again, they're not asking the world. We're asking very small things, but we have to do something.
For Newsy, I'm Lindsay Thies.